And now it's a pleasure to introduce Axel Nemetz, who is head of mHealth Solutions at Vodafone, and if anything is going to transform health and health prevention. I'm aware of that with Sally sitting in the front row. One mustn't forget this is about stopping people getting ill as much as looking after them when they have. And mobile platforms are going to be absolutely transformational. And I think Axel is just going to give us a glimpse into the future. And of course, mobile platforms are transformational across the globe, because many parts of the globe that never got fully wired for wired telephone communications are now wirelessly linked up in the most amazing ways. So Axel, over to you.
Thank you very much, Sir Mark, and welcome to all of you. I'm following up two great talks who were not only exciting, but on time. I cannot match a military background, but as I said earlier, I'm from Switzerland. I will stick to my 7.5 minutes, my promise. So what I would like to share with you are some examples of what you can do in the mHealth area, some very pragmatic examples. And I mean, this little device, I'm sure most of us have very close, completely changed our lives over the past 20 years. And some of you might be surprised how young our company Vodafone is. We are the world's largest multinational mobile network operator. But our heritage only goes back some 21 years. We are present in the mHealth area already since the late 90s. At that time, mHealth was not really a key theme. Price levels were still too high, but these days, the price levels are significantly going down. The quality of the connectivity is significantly improving, and we are coming to a point where the healthcare need and the mobile connectivity capabilities are getting closer and closer together. And what we can provide as a mobile network operator is basically to improve the freedom and the flexibility, not only for the patients, but also for the healthcare professionals. What I would like to do with you right now is I would like to guide you through 3 examples, and I will start with the emerging markets. 2 examples coming from the emerging markets. The first one is an example from Tanzania. In Tanzania, you have a very strange situation. You have every year 80 or 90,000 children dying from malaria. But at the same time, you have enough tablets available. But whenever a mother comes with her child to a clinic in order to get a treatment for malaria, she can run into a situation where the drugs are not there. And what we introduced over the past 2 years is a system that basically allows the country to map the logistic chain for the drugs. So nurses in Tanzania send every Friday a text message to a central server and provide the number of malaria tablets left in their clinic. They receive an incentive for that, some free voice time and text messages that makes sure that our compliance levels are above 90%. And with this very simple setup, combined with the internet, Google Earth, and other systems, we reduced the number of stockouts from 30% to 1%. So this is only one example of how simple a solution with mobile technology can be. Another example is also coming from the emerging markets. It's around counterfeited drugs. 30% of the drugs in emerging markets are counterfeited. It's an issue when you have a life-saving antibiotic, but it's not working. With a very simple technology, you can now take the blister of the drug, key in the serial number, not in a smartphone, but in a regular feature phone, and send it to a shortcode. In return, you receive an immediate validation if the drug is valid or not. And people in emerging markets do that before handing over the money to the pharmacist. It's actually not a pharmacist, but it's very often an owner of a corner shop. So these are just 2 examples. Now let's switch gears and let's come to the mature markets. In the mature markets, and Harry, I see you over here, your company allowed us to share the example from Baxter, from the UK, and Boston Scientific also allowed us to share an example from the international space with you. In the UK, Baxter is providing an infusion to people who suffer from an immunodeficiency. In the past, these patients had to come every 3 months to a hospital to receive the infusion. Baxter thought we can do better and developed, together with nurses and with our support, a system where the patients can now receive the infusion in their homes. A community nurse comes and sees the patient, applies the needle. The patient is in constant contact with the physician via a smartphone and monitoring the number of units he's infusing. And the system is received so well, not only by the patients, but also by the physicians, the satisfaction levels that people would like to use the system for good are actually, in the pilot, we did 100%, to our surprise, not only from the patients, but also from the physicians, that this is a game-changing approach which can move certain treatments from hospital to home. The second example from the mature markets is coming from Boston Scientific. People who have a cardiac pacemaker can now be remotely monitored by their cardiologist, because the cardiac pacemaker is connected to a little device on the nightstand, which is these days not connected via landline anymore, but via mobile connectivity to the cardiologist. So the cardiologist can now see that out of his 100 patients, there's one patient who has a red traffic light, and he should call him right away. 2 patients have a yellow traffic light, they should come in within the next 2 weeks. And 97% of his patients he doesn't need to worry about. So they don't even need to come in on a regular basis right now. And these systems are now becoming more and more prevalent because it's buying quality of life also for the patients. The last example I would like to share with you is also something Vodafone is currently developing, I would say, predominantly for the mature markets. We're having a challenge, in particular in Europe. 20% of our population already today is above age 65. And elderly people appreciate the most to live independently in their own homes. What we developed is a system that allows elderly people to do exactly this. Elderly people receive a tablet PC and can connect every morning to their medical doctor via a video conferencing call. Then you have in the homes of the elderly people some motion sensors and other sensors, which also allow to see, is the elderly person doing well, and maybe provide a text message to the children that everything is okay. And this is a system we recently piloted in Spain, and we had severe issues getting back our kids from the trialists because people enjoyed it a lot. And this is a product you should hopefully expect from us very soon. Now let me conclude by giving all of you a bit of an outlook how we see the world as Vodafone in 2020. And in a nutshell, our belief is that by 2020, and we put it a bit in a provocative way, I admit, brick and mortar healthcare facilities will only serve as a last resort. Because whenever it's possible for a patient, he will either be remotely monitored, or his disease state will be remotely monitored, or he will receive information via his mobile phone which relate to his health status. And we are seeing these days technologies like this technology in the middle from Proteus, which allows patients to monitor when they swallow a drug on their mobile phone. It's not this technology which is exciting, but it's the impact. In the pharmaceutical industry, the biggest challenge is a lack of compliance on the patient side. When you now have a chance to monitor the drug intake of the patient on the mobile phone and excite the patient, be it via vouchers for the gym, be it via whatever approach, to improve the compliance, this can be considered a game changer. So I'm not sure it will take until 2020 before we see that, because most of these things are already there today. Thank you very much for your attention.